Good morning. Thank you for joining us. We'll just wait a few minutes while everybody gets in. Good morning. We're going to give a few for everybody to kind of get in. Thank you. Good morning. We're going to start in about 1 minute. You'll just hold on. We're letting some more people come in from the waiting room. Thank you. Good morning. Thank you for joining us today. My name is Danielle Edmondson. I'm the Director of Communications here at Louisiana REALTORS. Thank you for joining us for this month's member benefit webinar. We're going to be chatting about healthcare member benefit program powered by CapCare today. We have Bridget and Margaret on with us for this webinar. Bridget is the co-founder of Concord Management Resources with 25 plus years of specialization in healthcare sales, marketing, and health plan management. Bridget is principally responsible for the planning, development, and ongoing management of various association health plans. Bridget and Concord have partnered with CapCare since 2021 to introduce and implement the local 426 healthcare member benefit program to various associations across the country. Bridget works directly with these associations and respective consultants to educate members on this unique and alternative healthcare option. Margaret is the managing partner of the PL Group LLC and has 40 years of experience in the healthcare insurance industry. She has worked with various associations to set up their member benefits program. In 2021, Margaret partnered with CapCare to offer their unique program to state realtor associations. So I'm going to turn it over to them. I think Bridget has a presentation that she's going to walk through the program with us. I know a lot of policies kind of renew at the end of the year, so we'll go through just different options and how to get proposals and stuff. Thank you again to everybody for joining us, and I'll turn it over to Miss Bridget. Hi,
Great.
Bridget.
Good morning. Thank you. Thank you, everybody, for joining the presentation. If you have not heard about the program, I hope we can give you some information that will give you an opportunity for an alternative option in the marketplace. And as Danielle mentioned, we work with various associations for this program. It is an exclusive healthcare member benefit program, primarily sponsored by a union-based sponsor. And we'll go into a little bit more detail about what that means. But now, and I believe for the last year, we've been working with Louisiana REALTORS. to provide you with an alternative, whether you're a 1099 contractor or a broker agent. You have access to participate in this member benefit program, and essentially you're becoming a associate member of Local 426. And again, we'll go into a little detail about what that means. We don't want the word union to scare you. It is kind of a very creative way, alternative way to provide and obtain health benefits on a larger group scale. So basically, Local 426 provides access to healthcare related benefits, which includes medical prescription, life insurance, accident 24/7, specified disease, auto accident medical reimbursement, and AD&D programs. So about the program, as I mentioned, this is a union-based program. So the sponsoring union is Local 29822. They are a self-insured health and welfare fund. They currently have over 12,000, maybe more participants. They are a toy and novelty union out of New York. And they give us 9 plan options to offer to our membership. So our membership becomes, as stated earlier, an associate member of Local 426. That is a union specifically for this population. There's no voting, no collective bargaining. Truly, it's a vehicle that allows you to obtain these member benefits. All of the programs include access to a national PPO network. So that PPO network is the Blue Cross Blue Shield Blue Card, which means you have in-network services in all 50 states plus DC and Puerto Rico. So out of the 9 plan designs, I believe 4 are network only, 5 have out-of-network benefits. However, due to the robust nature of the network, the PPO, there's very little need for folks to go out of network. We do have a concierge team that is in place to help you from start to finish, whether it is to generate a proposal, help you with the enrollment portal, answer benefit questions, identify anything that you might need prior to enrollment or even after enrollment. So out of the 9 plan designs, we do have ACA compliant health plans available. And when we say that, when we say available, that means there might be a couple benefits that deviate from ACA essential plan designs. So for example, one plan does not have a mental health benefit. All 8 others do. We do have 100 preventative care benefits available. And again, same type of thing. We have 8 plans that your preventative care services are covered at 100%. One that is a minimal copay. I believe it's a $10 or $25 copay. All the programs, these are comprehensive health plans. They have doctors, specialists, urgent care copays, in-network deductibles, co-insurances vary by plan. We also have considerably low out-of-network maximum out-of-pockets, which in-network maximum out-of-pockets, which if you look at the exchange or you look in the commercial markets, they tend to be significantly higher. We even have a copay-only plan option. It's no deductible, no co-insurance. Also, rumor has it that we will be offering an HSA option, a health savings account, which we've been asking for. That just gives additional flexibility for business owners to put money in an HSA where those monies can be used for medical expenses. And again, those are on pre-tax basis. So more to come. That will be hopefully January 26th, but more to come on that. Important information about the plans. So as I mentioned, we have the 9 plan designs. The plans vary. They, as I mentioned, different deductibles, different co-insurance, copay only plans. The rates will be relevant to the plan design. We do provide the SBCs, which are the summary of benefits coverage, and the summary plan documents, the SPDs. They are located on the enrollment portal. So we want to make sure that when you are choosing your program, you have all the information that you need to make sure that you can compare what you currently have to the programs that we have. We also have a mandatory mail order for the prescription. That means that if you do have something other than a one-off medication, like an antibiotic or something that happens, once a month, a couple times a month, the program does require you to utilize the mail order. It's easy. I do it. Your provider calls in the prescription, and then you get mailed the prescriptions every 90 days. This program does have a few exclusions, a couple caveats that are important to make note of. So specialty drug medications, there are certain specialty drug medications that are excluded from the program. However, physicians can submit a prior authorization to the pharmacy vendor. Depending on that prior authorization, it may be covered under the program, or if it's denied by the program, then we have a third party. It used to be called Paramatrix. Now we're going to be utilizing Healthcare Advantage. They will assist members with obtaining that medication either at manufacturer's rebate, coupon, or a lower cost. So we have a formulary available that can be shared. If anyone is on any medications, we certainly can go through that list and identify if you're impacted by this exclusion. The other exclusion is the union does not pay for medical expenses related to an automobile accident. Really, if you look at the historical medical claims paid, it's literally only 0.8% of all medical claims are paid due to an automobile. Reason being, folks have their own personal insurance, or if you go into litigation and subrogation, those entities pay. However, we have, based on, hearing feedback and what have you from members, we have provided an auto medical reimbursement policy. It is already included in the contributions or premiums on a monthly basis. So you will gain access, if you enroll in the program, you will gain access to unlimited auto medical reimbursement. It will pay 100% of your claims after your auto medical or subrogation benefits. Depending on the tier of coverage you enroll in, the medical program will be the tier of coverage that you obtain for the auto medical. With that, there's also an accidental death and dismemberment benefit that is also included with the auto medical. That pays, I believe, $150,000 in the event of accidental death for the primary member, and then it reduces based on spouse and children. And again, we have all of this information. When you look in the system, we can provide it, so you certainly can make a determination if it makes sense for you. So out of the 9 plans, obviously I want to just touch on high level. We do have the rates available if you generate a proposal or if you request a proposal. We start with our base plan. It has a $3,000 in-network deductible, 50% co-insurance, but your maximum out of pocket is considerably low, meaning that you have a $5,350 maximum out of pocket per individual. So essentially what that means is you pay your monthly premium. I believe for single, it's $758. If you utilize services, you pay your deductible first, then 50%, maximum up to $5,350. So This is a plan I like to consider. It's a pay-as-you-go type plan. If you know you don't have a lot of health needs, you want it for catastrophic, this is a great plan option. As the plans go through, we have different plan options that have out-of-network benefits, have maximum out-of-pockets out-of-network, meaning you can go in and out of network providers. We also have a program going to our highest level plan. It's our ASO plan. There's no deductible in network. There's a $1,500 deductible out of network, no co-insurance in network, 30% out of network, no maximum out of pocket. It's a copay only plan. So for your physician specialists, it's a $25 copay. Out of network, you have deductible, then co-insurance. And then this is the one program, as I mentioned, your preventative services are at a small copay, $10 per child, $25 per adult. So this is a program that literally you would see in the 80s, what I call your sleep insurance. You pay your premium, and then at the end of the day, if you utilize services, you're paying a copay. Give you an example from a cost perspective. I believe for a family, it is currently maybe right over $3,000 or shy of $3,000 premium for a family. You get a program like this in the marketplace, easily it's around $5,000 to $6,000 for a family. The program also has supplemental options. We have an accident 24/7. It's like an AFLAC. We have specified disease, hospital indemnity. You do have to take the medical programs to enroll in these ancillary products. Nice thing about these products, there's no medical questions. There's no pre-existing. They essentially pay you a lump sum based on whichever benefit you choose. It can help pay for out-of-pocket costs. And with this, it's a cash benefit. If you choose the life benefit, which is at the employee only, again, no medical questions, no pre-existing. We offer the life at a 10, 20, 40, 50, and 100,000 benefit. They are portable. So if you did leave the program, you can take these programs with you. So to find out if your providers are in network, we do tap into the Anthem website. They manage the network, so you can follow these instructions to look up your providers if you are not enrolled. It gives you a step-by-step. You look under the National Blue Card, you can put in your state and it will list. You can look up providers by name, by location. It has a lot of drill downs for you to be able to do that. So we have a simplified enrollment process for broker agents, 1099 contractors. The process really starts with receiving a proposal. Everything that we do is systemic, meaning that we do have an enrollment portal for the employer, the broker agents, or 1099 contractors. So if you wanted to receive a proposal, you can request a proposal from our team. I also believe behind the member login on the Realtors website, there are instructions how to generate a proposal and step-by-step what to do moving forward. This is the information that we would need pretty simply to generate a proposal. So again, if you didn't want to generate it yourself, you can email our team. Simply, you can email our team saying you're a Louisiana Realtor, you'd like a proposal. Our team will ask you for this information, and then we'll generate a proposal and send it to you. When we generate proposal, we'll also send you an account activation link. Not that you have to create an account, but really what this does is if you want to move forward for the ease of the process, you then can click on that link, set up an account, and move forward with your enrollment. The enrollment takes, if you're an independent contractor, 15 minutes max. If you're an employer, broker, agent, depending if you're loading employees, it could take anywhere from 15 to 20 minutes. If you have employees, you can then send them the links and they can do their enrollment online. We have paper. We can take paper applications and assist yourself or your employees with that enrollment as well. So a couple key dates and information. So the rates right now, if you were to receive a proposal today, are good through 12/31/2025. So anyone that enrolled in 25 will have a new rate period come January 1st. We have effective dates always on the first of the month. So right now we are 30 days in advance. So right now until the end of September, we're enrolling for November 1st. If you are enrolling and you're enrolling a spouse or dependent children, the union does require marriage certificates for a spouse, birth certificates for dependent children. We know not all those are readily available. So we do have some alternative options. If you don't have those, our team can assist you with what you would need to complete that enrollment. The invoices are generated on the 10th of each month prior to the effective date. You'll get an email notification stating that your email is ready, and then we process payments on the 13th. So you will put in, when you set up your account, you will put in either a credit card or a bank account. And what we've done in our system, we don't save that information in our system. So you will go to the payment method, you will submit validation. It moves over and validates from the payment processor, which is Fiserv, and then it sends us back a token and only the last 4 digits of the account. So we're not holding anyone's account information systemically, and that's to protect your data and your information. Again, we process payments on the 13th prior to the month. If you do pay by credit card, there is a 2.5% fee. Failed payments for any reason, we have a non-sufficient fund fee. And then if we run down to the wire fees, we do require, it's a $30 wire fee. So with the union, cash equals coverage. So we need to ensure that we collect all of the contributions or premiums prior to the effective date. So once you enroll, what you can expect after your enrollment, each member will receive a welcome letter that includes important plan information, contact information, a temporary ID card. Reason being is permanent cards come from the primary union, Local 298 or 22, and it normally takes 7 to 10 business days after your effective date to be received to your home. Once you receive your ID card, you will also, your permanent card, you will be able to set up an online account through Anthem's website. You can view claims information, look up providers, other resources, whether they are discount programs, virtual telemedicine, but the EOBs come directly from the union. Those are your explanation of benefits regarding claims, as well as the ID cards. So the Anthem site is really more of a resource tool for members. So our concierge team, as I mentioned, we are here to help you from everything from generating proposal, helping you with enrollment, answering benefit questions. Once you're enrolled, we want to make sure that if you have any issues, whether the union's asking for information, whether you have need for additional ID cards, you need to add employees, terminate, our team is here for you. So we do provide this contact information for you. And then last but not least, kind of give you an idea of what the ID card looks like. So it does have the Anthem logo. Your plan information will be included. Important phone numbers will be on the back of the ID card. And again, as a member, you are welcome to contact any of these entities. But for ease of the process, we are here to help facilitate that. right? So we would be your first line of defense if you need help. That is here, what our team is here to do. Okay. So are there any questions?
We do have the Q&A open, so if you have any questions, feel free to drop something in the Q&A. Also, I'm going to put into our chat the link to this page that's on our website. It is under, if you scroll, go to larealtors.org, scroll over Realtor at the top, and then down to member benefits, and then it does pop open a healthcare member benefit program. Is going to be the option. I'm putting it in the chat now, the direct link to it. Looks like we have gotten one question, Bridget. Let's see. Does association staff qualify for enrollment? And I think we kind of talked about this right when we first launched. Bridget, it does include association staff, right?
It does. So as long as the association is offering the program, then yes, association staff does qualify. So the union's qualifications are you have to be actively at work. That's why independent contractors can enroll. And then if it's a new hire, a qualifying event. So if it's a new hire, you have to be actively at work for 30 days. If it's qualifying event, you have 30 days from the loss of coverage to enroll, and it would go back to that enrollment date.
Perfect. Next up, it looks like if we have Blue Cross in Louisiana in the private market, is it safe to assume the premiums would be cheaper going through this program?
Richard, I wish I could say yes, but again, I think some of that based on the commercial market. If it's commercial, they are rating based on age, gender, pre-X. If it's a medically underwritten program, our rates are our rates, right? So these programs may be a little bit more expensive, may not. Also, in comparison to the exchange, if you are receiving a subsidy, then if those subsidies go away. So it's hard to say for certain, but we do ask that you just take a look at the proposal and do a compare. These plans tend to be much richer in plan design. And again, remember, it has the national PPO network. Mia, there is no pre-existing on these programs. So it's 4-tier rates. As long as you are actively working, you pay your premiums. We cannot deny coverage to the program. Amber, you can request a proposal, and then the proposal will provide you with a breakdown of the pricing. And again, remember, as I mentioned, we are in 2025 rates. So we have these rates for the next 3 months. The initial, what we're seeing and what we're hearing is, in addition to the HSA plan option, we are hearing that the 26 rates will come in probably below 10%, definitely below 10%. But again, we won't have those rates in our system available probably until the first week in October.
All right, Marlene says, if you put your realtor's license in referral status, will you still qualify for the benefits?
Referral status. So again, as long as you are actively at work, you have to be hanging your license. If you're a 1099, you do need to be hanging your license in a broker agent's office. If you have your own LLC. So again, that actively at work is the critical criteria. And if you still have your license with Louisiana, then yes, you would qualify.
And then we do audit, the list and stuff just to make sure everyone's still an active member of LR for the policy. So.
Yeah. So Stephanie, as far as if you're receiving Medicare, Social Security benefits, this program, it would be primary. So it does not make sense, to pay the premiums if you have a Medicare benefit, quite honestly. So the deadline to sign up, so we do a rolling monthly enrollment. So right now, typically the last day of the month, 30 days in advance, right? So we are currently 9/1 to 9/30 is an 11/1 open enrollment. We can extend that probably up until the billing cycle, which would be the 10th of the month. Reason being, we want to make sure that we've been able to bill and collect the funds for the union because we have reporting. So typically 30 days in advance is the cutoff for that effective date. Open enrollment for January 1 probably will be extended because we know open enrollment in January is a bigger month. Typically, we've gone into the first week in December, maybe even into December 15th to allow that open enrollment.
Bridget, I wanted to go back for a moment on subsidies.
Yep.
Anybody who's receiving a subsidy through the market exchange, that is subject every year to your income. And if you have a good year, which we hope all realtors do, and sell a lot of homes and commercial property, etc., then what happens, IRS can come back to you and ask for that subsidy to be returned. And not just for 1 year. If you've received a subsidy for 2 years, let's say it's $5,000 each year, they're going to ask you for $10,000. So that's a real shock, I know. But I have personally talked to realtors that had to pay as much as $23,000 back because they were receiving a subsidy for several years. So just keep that in mind.
Yeah,
if you were on
thank
that
you.
program.
Yep, thank you. And like I said, it's a tough market right now, especially if they're going to end the subsidies and the tax credits. People are facing some significant changes in the market. So, we do believe this is a viable option. It's not going to be for everybody, but it is an alternative, especially for the sole proprietors, 1099s. But it's doing your due diligence, understanding, what your options are. So Deborah, the union, so the sponsoring union is Local 298-22. They are, again, a toy and novelty union out of New York. They've been in existence for over 50 years. Our union, Local 426, is the union that all of our members, Louisiana Realtors, as well as other association members, come into. So by being an associate member, you do pay dues. Those dues are included in the rates. So it's not an addition to, it's already included. You get access to these benefits that Local 426 is offering. As I mentioned, there's no collective bargaining, there's no voting, no one's going to knock on your door and ask you if you want to pick it. It really is a vehicle that lets you gain access to these benefits. And this is something, it's not unique, it's just a different way to provide the benefits. This is something unions have been doing for the past 30 years with apprentices. So if you have an apprentice, if you're an apprentice of a union, you're not a full-fledged union member, you can't vote, you can't collectively bargain, but you get access. So this is the same premise that we're able to offer this down to members. So Stephanie, yes, the December 15th deadline will be the January rates. And again, we anticipate having those available in the system to generate a proposal. Hopefully in the next couple weeks. We're just finalizing the rates. We have to build it in the system. As I mentioned, they're talking about an HSA plan option. So all that has to be built and put in the system to make it available for all of you.
Marlene, I do see that you were raising your hand. If you have a question, would you mind dropping it in the Q&A just so we can get that answered for you? So we are recording it. If you, we do have it behind the member portal and stuff, but we'll, validate everyone's membership on here and send it out to those, that attended or just registered, so we can send you the link to it. But it is hidden because it is something that is exclusive for members. So thanks,
Yeah.
Marlene. Looks like we answered her question. So good.
Okay. So one thing that, I think what happens in the market, and Margaret can speak to this from the commercial side of things, healthcare premiums are like an EKG, right? You never know where it's going to be. The exchange has made it a little bit more affordable and consistent, but the plan designs in the market may not be as rich as what people are used to. With this program, the benefit is that we are able to leverage the law of large numbers, right? So our population is about 6,000 members. The union itself is about 12,000. So by being able to spread that risk and really kind of come under a large group plan, not one group or one entity is being impacted by that. Everybody gets the same rate. Everybody gets the same, benefits. So historically, as I mentioned, Margaret, we've been working on this program since 2021. For the first 3 years of this program, there were no rate increases on our book of business. Okay. Part of that was we were still growing. The enrollment wasn't that significant, but as you start to grow, there are increases. So in 23 to 24, we had a 7% increase overall. Part of that increase was administrative fees, stop loss, right? But the medical plan itself running very well. 24 into 25, we had an 8.9% increase. Part of that increase was adding the auto medical expense reimbursement rider. So that's built in, so it becomes part of the rate. So again, the rates are fairly, budgetable and consistent. And then this year, again, it's coming in under 10%. So what I would say about that is, yes, 9-10%, that seems high. However, based on the industry, small group, it fluctuates so much that, number one, these benefits don't change. No one is lowering your benefit levels. Number two, you have the national networks, you have the value of the law of large numbers. So there are, huge benefits to that. What our goal is to do with Margaret, ourselves, is to figure out how we can continue to enhance the program, how we can continue to bring you, affordable options. And, this is just one. We hope that, if last year you got a quote, maybe it didn't, you weren't ready, maybe you just wanted to see how it played out, we're here, and the plan is running well, it's doing well. And I think that, from Margaret's and my perspective, I've been enrolled in this program for almost 4 years now. What's nice about that is, from an enrollment process, come 1/1, if I'm comfortable where I am, I just auto renew. I don't have to fill out paperwork. I don't have to re-up. I just auto renew at the same rate that I have, or at the same plan at the higher rate. You can make plan changes at renewal. You can add employees at renewal. So we've tried to make it simple and flexible. So Deborah, yes, the rates, there's what we call a rate increase, it's a rate period annually. If they increase annually, that is likely, but, yes, there's a new rate period every January 1st. So the auto medical reimbursement, Mia, it's an additional policy, right? So in the event you were in an auto accident, what happens is this program picks up after your personal auto coverage. So depending on the accident, let's say your auto policy covers 50,000 of medical expenses, but you had 100, this auto medical would pick up that additional 25,000, 50,000. Okay. So it covers the gap. So in commercial programs, what happens is if you're an auto accident, your medical plan becomes a supplemental. So this program is not, it now falls back to this auto medical reimbursement. There is an additional cost, but it's already included in the rates. So when I quote a $758 rate in the base plan, that includes the union dues, that includes the auto medical policy. Pre-approvals for auto medical, no, there's no pre-approvals. Your standard services would require pre-authorization, right? So specialty meds require pre-auth, surgeries pre-auth, different scans. The SBCs and SPDs all provide what requires pre-approval, but you automatically get enrolled in the auto medical program when you enroll in the medical benefits. If anyone has questions that they're not comfortable asking in this forum, certainly, I believe our phone number is on the website. That will get to any one of our concierge team members. They can answer any questions, provide you with any information, that you might have. So an echo, and again, I'm not looking at the summary plan documents, but that probably would need a pre-authorization. So the doctor would do what they standardly do, right? That's not atypical for commercial coverage. They would call the number on the back. If you look, we have a pre-authorization number here. They would call, put in the reasons for the echo, get approval, and then schedule your test.
All right, no more questions? Anybody? All right, you can find more information about the program on our website, larealtors.org, under the tab Realtors at the top, scroll over Member Benefits, and then Healthcare Member Benefit Program. To get a proposal, you will need to log in with your NAR login through the M1 system. Click Get a Proposal, then you'll sign in with your M1 number and password, and then just click the Cat Care banner, and it takes you to their members side. If you have any questions about the program, the contact information is on the website. I did just put it in the chat as well. If you have any questions about any other member benefits or anything, please feel free to email us at info@larealtors.org. I want to thank Bridget and Margaret for joining us today. I really appreciate it. It's been a bit since we've done this, so I was glad to kind of revisit and introduce it to members with the updates, the auto being the big one. So please join us next month. We've been doing regular member benefit webinars, so I hope you join us. And like I said, once we just validate membership on the call, we will get the recordings sent out to everyone. So thank you for joining us. Have a great Friday and a great weekend.
Thank you, everybody. Have a good weekend.